Hey everyone, welcome back to BioNexus Health Podcast, BioNexus Health Podcast. Sorry about that. Today we are traveling to New Jersey. I'm not traveling too far, but we are going to be speaking with Maria. Maria was referred to me by her primary care physician, and she has made great strides in her health and wellness. She's been through a lot for many, many years and has struggled through a lot of symptoms. And she's finally beginning to feel much better. And I requested her to share her journey with Lyme disease and biotoxin illness, mold exposure, and lots of other symptoms that she experienced. So let's welcome Maria to the show, to today's podcast.
Welcome to the BioNexus Health Podcast with Dr. Jodie A. Dashore, who holds a PhD in integrative medicine, is board certified in integrative pediatrics, an internationally recognized pioneering clinician, and author. And now here's your host of BioNexus Health Podcast, Dr. Jodie A. Dashore.
Hey, Maria, how are you today?
I'm good, thank you.
Good. I'm so glad you're here. Thank you for being here.
Sure.
So, well, I don't want you to be nervous. It's just a regular Zoom conversation, with a little record button going on at the top there. That's the only difference.
I can't. Oh, yeah, I can see it. Okay, fine. I'm not going to look at it.
Uh-oh, did I make you conscious now?
Okay, no, we're good. We're good.
Good. Okay. So, I know that if I recall correctly, you were referred to me by your primary care physician.
Correct.
Right. And so can you tell me what symptoms were you struggling with? What health issues were you struggling with when you came to me?
Yes, I can. And I can tell you before I came to you, I was struggling with them for a very, very long time, but I was passing them off as this and that. I'm getting older. I work too much, not getting enough sleep, all that sort of thing. So my primary care knew much sooner than I did that I had the problem, and she was encouraging me to get help, but I was in denial. So what the symptoms I had were the greatest symptom, fatigue, incredible fatigue, headaches. I developed peripheral neuropathy in my feet. I think it's about 12 years now that I've had it. Mm-hmm. And it's gotten progressively worse over time. But what finally caused me to call and start this ball rolling is it got so bad that we were having a hard time managing it with just the B12 that I was taking and the alpha lymphoic acid. So my doctor felt that I might have had a reoccurrent Lyme bite that caused that neuropathy to get extra prominent. Mm-hmm. When she took the test, I did not have an active infection, but that was the step that caused me to move forward to see what we could do, because she had been encouraging me for, I would say, probably 3 years.
I see.
Seek alternate treatment.
Yes. And you were aware that we will be using only all natural herbal supplements. We'll be doing additional testing, looking for the root cause, because Lyme doesn't ever come alone.
Correct. Yes. So that's why you are my practitioner, because you do the herbal natural approach. And as we know, people that have the issues that we have of biotoxin illness can very well have drug sensitivities. So why would we want to go that path if we don't have to? So I'm very glad that you were available. As far as I could tell, you're the only one that I could find that was offering this type of protocol.
Yes, you mean completely natural.
Yes.
Options for mold illness. Yes.
Yes.
Yeah, I had to come up with that to help my son. And yes, you know, like you mentioned, people with biotoxin illness or mold illness can get multiple chemical sensitivities, right? Sensitivities to many food items, dietary issues, of course, you know, pharmaceutical drug sensitivities as well. So natural protocols work well for people with all of those sensitivities. Yeah.
Yes.
So we did a lot of testing for you, and we actually uncovered infections and toxins and, you know, environmental issues. So can you touch a little bit upon that? You know, were you shocked to see everything that was going on in that little body of yours?
I was, as I said, I was in denial for a long time. When I came to you, I was at the point, well, I hope you find something, right? And so I could be treated. I wasn't expecting what we found. And I was like, wow, like how can a body function with all those contaminants that are not positive in any way? Very detrimental findings. And I was shocked to realize that a body can still function somewhat with all of that. But I don't want to say I was happy, but I was kind of relieved because it justified what I was feeling. And a lot of people who see me and meet me don't realize that I'm having health issues. On the outside, I look relatively healthy. Some days I look tired, as any person would look tired who had a demanding job and other obligations in life, as we all do. So I was glad that I was at a place where treatment would be available to me. And maybe I could feel like a normal person again.
Wonderful.
Yes.
So shall we talk about the improvements you saw with your gut, with your neuropathy, with your sleep?
Yes. So my gut issues, I didn't realize I had gut issues. So, you know, when I found out I had the infections, I said to myself, well, I have a pretty strong gut, because from entrance to exit, in my mind, that was the one body function that was working well. Or so I thought. I didn't have pain. I didn't have discomfort. I probably had bloating, but I had accepted that over time, so I didn't know that was an issue. I was not in pain. Now we had our testing. We found out from 8 infections, I went to 4. And during that time, I have found that things are working better when I wasn't expecting them to work better. So by definition, my gut is functioning better. And I know that based on my bowel habits. And also, I had intense sugar cravings all the time. I'm not going to say they're gone. It would be a lie, but they have receded somewhat. So that's also a positive sign that my gut is feeling better. And I know we have more work to do, but we are getting there. Also, I suffered from great headaches. I always had a headache. I always blamed it on sinus. We found out that I had heavy duty nasal infection with biofilm and resistant bacterial growth that you fixed for me. That was such a huge improvement, because I had so much pressure all through my sinuses, but I was not congested. So I could blow my nose. There was nothing to blow. I could go to a doctor and the doctor would say, well, your nasal passages are clear. You know, you don't, but it wasn't really, because there was those bacteria and whatnot that had made their little home in there. They were very comfortable. And we knocked them right out of the ballpark. It took a little while, but I can tell the difference. So my headaches are better. And I think I still get little ones, but not what I had. They were so heavy duty, and my whole face felt uncomfortable from pressure related to my nose. So that's a huge improvement. The neuropathy in my feet we're still working on. I mean, it's not gone. I'd like to say it is, but we're still working on that. I'm hoping as these bacteria and infections and so on detoxify, eventually those nerve endings will heal. But we're still detoxing. So I think we have a little ways more to go before. That was the first real thing that came forward. So it's probably going to be the last thing to leave.
Yes.
So,
Yeah.
but overall, my fatigue, I still have fatigue, but it's not overwhelming like it was. And now I've learned how to manage it better, because I think we discussed once, I was feeling so much better at one point that I started behaving in a very active manner. And then I had a setback in terms of fatigue because I overdid it, not realizing that I had to go slow. I got too excited. But now I understand how to handle my extra energy and when it comes, and I use it appropriately, and I do not exhaust myself.
That's really good to know, and you touch upon a very important point, is overdoing it after feeling better, after being ill for so many years. For the first time, you feel halfway normal, you're like, all right, I'm going to go out there and do what I always like to do. I mean, I don't blame you, because after being given, I believe you mentioned, to me that all of these depressing diagnoses like Sjogren's and Hashimoto's and Lyme disease and osteoporosis and, chronic fatigue and what have you, you finally found, we ran all the relevant labs, and we finally found, I won't say all, but most of the root causes.
Yes.
And we have been addressing those. And you have been slowly, but surely feeling better. So that's good. That's very good. Your immune system has healed really well as well. You also mentioned that you're now able to sweat much better.
Yes. Prior to coming to you, my body, when I was a little kid, I used to sweat through my head and my feet, never my armpits. After, I think after puberty, most females can sweat through their armpits. I would never sweat through my armpits. It would have to be like really hot and humid, and I'd have to exert myself before. So I know I had the right sweat glands, they just weren't producing. Since being on your protocol, I started sweating through my face, and then later, normally in normal appropriate situations, through my armpits. So that's a mixed blessing, because part of it was nice to not sweat, because without the sweat you don't have body odor, but the body has sweat glands for a reason, and they're meant to be used because it is a way of excreting toxins. So I'm glad that my body is working appropriately. I only sweat through my face now, on my forehead, if it's very hot in the summer. I don't know if it was some of the start of the protocol and my body wasn't used to it that caused that sweating, but I don't have that now. And if I do, it's very little on the forehead, but at least my armpits behave normally now. So that's a very good thing. And that's not something you really think about, like you just take for granted. If they never worked the way other people do, you say, oh, well, great, I don't have body odor. But really, you need it. So I'm glad that my body is functioning or starting to function appropriately.
Your cardiac symptoms, the heart,
Yes, I was diagnosed with a form of tachycardia, and now I don't, they say it never goes away per se, the diagnosis, but I haven't had the symptoms since I started on this protocol. So that's a very good thing too. Uh, you know, that's a very good thing.
Absolutely. Many patients get put on pretty heavy duty pharmaceuticals for the kind of cardiac issues that you had, tachycardia, right?
Yes,
Believe it was supraventricular
that's
tachycardia,
correct. That's
right? The
exactly what it
SVT.
was.
Yeah.
Yes. And I also, well, I for like 3 years before treatment, I was not having a normal heartbeat because you don't always feel the tachycardia, but my primary care sent me to a cardiologist. We put on a monitor, and that's how we found it, because a regular EKG is not going to show the tachycardia per se, but
Mhm.
it will show an irregular heartbeat. So the cardiologist didn't feel that I needed to be treated for the tachycardia at that time unless it got worse. But at the same time, I was started the protocol, and it's pretty much left. Every once in a while I'll get a little flutter, but it doesn't develop into anything. Whereas and now my heartbeat is normal. So I've had, I think, 2 normal EKGs over the last 2 years, and they come back normal, like a normal heartbeat. So that, that's a wonderful thing too.
Yes, it is.
Yeah.
Yes, it is. So that's huge. Now, your ocular migraines are much better, you said, right? Are they gone?
I only had one, and I haven't had another. So I'm going to say they're gone.
Nice.
Let's
Yes.
say they're gone. And also, I I believe we added vitamin C to our protocol, which helps with that, with migraines, I believe, in general. So any little residual headaches seem to be gone as well since we added the vitamin C. I
Good.
rarely experience a headache anymore, which is really, really an excellent thing because I live with them on a daily basis to some degree. And I thought, of course, at the time it was mostly sinus, but I think it was a combination of many things that caused the headaches.
I like how you put that it was a combination of many things
Yes.
that led to the headaches, because usually, when you look for symptom relief, oh, it's a headache, let me pop some pills.
Right.
But it just comes right back the next day. You need to address the root cause, which is what we did.
Which is what you did, and the vitamin C sealed the deal, so to speak.
Nice.
So yeah.
How about you had cracked lips, dry mouth, feeling parched?
Yes. So that also has cleared up. I was diagnosed with the Sjogren's,
Yes.
which is famous for dry eyes, dry mouth, and so on. Any body part that has a mucous membrane or near mucous membranes is going to feel dryness.
Mhm.
So some of that has been alleviated too. Sometimes in the winter when it's really dry, I still will get a little dryness and chapped lips, but for the most part, the dryness has subsided. I still do take eye drops though. That is probably one of the things that's going to be on the tail end of leaving also through treatment. But the dry mouth, I mean, my dentist even said that looks better, because she's always watching after my gums, as she should. And it's serious business. I mean, because you can have dental decay from dry mouth. People may not realize that, but we need our teeth. So yeah, we want to keep our oral hygiene as best as possible. And my dentist has seen improvement in my mouth.
So, Maria, that actually brings me to something that you had mentioned, and that was absolutely fantastic at your last appointment, was the recent incident where your husband had the flu.
Yes. So we had discussed about me getting the flu shot or not getting the flu shot, and we decided that we were going to work with the herbals. So you introduced me to 2 different herbals that I would use through the flu season. So we started in the fall and we would finish through March or April. March, at the end of March, you stop. My husband had the flu shot, came down with the flu 6-8 weeks after the flu shot. And he was very ill through the night. And I was obviously with him, exposed to him because it came on suddenly, as flus do. And I did not have the flu. I did not catch the flu, even though we were in the same bedroom. We had to use the same bathroom. Of course, we cleaned up the bathroom after he got sick. And he was sick for, well, very bad symptoms for 24 hours. Feeling sick for 3 days, and then heavy duty fatigue up to 7 days. So I avoided all of that through taking tinctures that were directly for flu and virus control.
That is just, blows my mind completely. I'm so happy to hear that. I'm sure other people will be happy to hear that as well, that your immune system, for someone being diagnosed with a couple autoimmune conditions.
Yes.
That your immune system is under control. It not only under control, but robust.
Yes.
At this point.
And better. Yes.
Yes. Yes. So, I mean, it's very heartwarming that you were able to share your journey with people today. And I know it's going to bring a lot of hope to many out there listening, with the chronic conditions, with chronic fatigue, with headaches, with Lyme disease, with mold exposure, and knowing that it is entirely possible to recover with a plant-based protocol without any drugs.
And without side effects that drugs can cause.
Yes.
So, yes.
Very well said. Yes. Yeah. That's an important point as well.
Yes.
Good. Well, I don't want to keep you too long. Today is Saturday, albeit a rainy and bloody Saturday.
Yes.
But, I hope you have a wonderful weekend ahead. And thanks so much for joining me today for today's podcast.
Thank you for having me.
All right. Well, that brings us to the end of today's podcast. I hope it was insightful for those watching. Remember to subscribe to the podcast. That's very helpful. And keep smiling. I will see you at the next BioNexus Health Podcast. Until then, goodbye and namaste.
Thank you for joining Master Herbalist Dr. Jodie A. Dashore, Director of the BioNexus Health Clinic and BioNexus Herbals, on the BioNexus Health Podcast, where we explore and share information and stories about recovering and healing from chronic and environmental illnesses such as mold biotoxin illness, Lyme disease, autism spectrum disorder, fatigue, Crohn's and colitis, mast cell activation syndrome, PANS, and more. Please help us grow our message by subscribing to our podcast channel and sharing the podcast on your social networks. For more information, visit bionexushealth.com.
Information within this video, audio, or text, collectively known as the podcast, has not been reviewed by the FDA. Nothing within the podcast is intended as or should be construed as medical advice. Information is for general informational and educational purposes only. Consumers of the podcast should consult with their healthcare practitioners for medical recommendations. Seek the advice of a qualified healthcare provider. Do not disregard the advice of a healthcare provider based on any information from the podcast. The information within the podcast may contain information concerning dietary supplements or over-the-counter products that are not drugs. Our dietary supplement products are not intended for use as a means to cure, treat, prevent, diagnose, or mitigate any disease or other medical or abnormal condition.